Today we are going to talk about neglected femur shaft fracture treated with gradual distraction by Ilizarov frame. A 26-year-old male presented with shaft femur non-union since last 4 years. 4 years ago he sustained an accident in which his popliteal artery was injured. It was repaired, but in index surgery the femoral shaft fracture was not treated, and later on patient neglected it and landed up in non-union. Patient had shortening of 6 centimeters and stiffness of the knee. The X-ray of the patient shows angulation, overriding of the bone fragments, few callus bands, and a bony spur on which the proximal fragment was resting. These are clinical pictures of the patient showing a healed scar in the popliteal fossa, shortening of the affected lower limb, valgus deformity at the left knee joint, especially on the weight bearing, and hyperextension of the knee joint. These are preoperative videos of the patient showing limb, hyperextension deformity, and a valgus at the knee while doing weight bearing. There was also an abnormal mobility in coronal plane and the limited knee flexion was present of the patient. Treatment options: open reduction and internal fixation with either intramedullary nailing or plate fixation with bone grafting, but acute correction in this scenario may lead to neurovascular stretching. Another option was limb shortening and fixation with either nail or plate to achieve union and later on address the shortening. Third option was gradual correction of overriding with either Ilizarov frame or LRS application after doing osteoclasis. We decided to go ahead with Ilizarov frame application with the aim to achieve union first and quadriceps plasty in a second stage to get knee range of motion. This is a preoperative plan which is showing ring 1 at the level of distal femur, ring 2 at the level of mid shaft which was close to the non-union site, arch 1 was at the level 10 cm distal to the lesser trochanter, and arch 2 was at the level of greater trochanter. As it is shown by blue dots shows the position of olive wires, and the green dots shows the position of shank screws or shank pins. The direction of distraction is shown in by this red arrow. The rate of distraction was initially, that is around first 15 days, was 1 millimeter per day, and after that it was 1.5 to 2 millimeters per day. So through a small incision, osteoclasis was done with the help of 5 mm osteotome after frame application. Initially, 1 centimeter distraction was achieved on table with the help of frame. The gradual distraction of the fracture fragments was done at the rate of 1 millimeter per day for initial 15 days, and then from 1.5 millimeter to 2 millimeters for next 15 days. This prevented the acute neurovascular stretching. As you can see in these serial X-rays, from immediate post-op to X-ray after 1.5 months, there is a significant distraction of the fracture fragment has taken place. Application of Ilizarov has not only distracted the fracture fragment, but it has also helped us to correct the angulation deformity which was there previously. After 1.5 months of distraction of the fracture fragments, open reduction was achieved. The bone ends of the fractures were freshened up, the medullary canal was opened, and fracture was aligned with the help of frame, and an antegrade titanium elastic nail was inserted across the fracture site with the frame applied to maintain reduction to achieve further stability. Over the titanium elastic nail, the gradual compression of the docking site was achieved with the help of frame. Patient was doing full weight bearing during the entire treatment span. You can see this is a range of motion of the patient, and this is the gait of the patient with the fixator applied. This is patient walking without support at his home, and you can see the post-operative X-ray at 3 months after fixation and X-ray at 6 months after fixation. After dynamization at 6 months, the Ilizarov frame was removed. The fracture united without bone grafting with no angulation deformity, and overriding is fully corrected. The tense is kept in situ, all pin tracts are healed, and the patient is walking without support. The limb length is corrected. Patient will be subjected for quadriceps plasty in second stage. Since we did not use any intramedullary interlocking nailing or plate fixation in this case, so the fixator time was longer in this case. These are post-operative clinical pictures of the patient after 8 months, which is showing correction of limb length, correction of deformity, loss of hyperextension, healed scar, and active straight lacing of the patient. This is a preoperative video of the patient which is showing shortening, deformity, and hyperextension of the knee joint, while this is a video after 8 months showing correction of limb length, loss of deformity, and loss of hyperextension at the knee joint. Thank you very much.